Welcome to the Low Back Pain Lifetime Elimination Program. My name is Dr. Nick Hunter. I'm a doctor of physical therapy, and I own and operate Preferred Physical Therapy, where we help people aged 40 plus stay active and independent, live free from painkillers, and avoid surgery, even if they've had pain for years. All right, in today's video, we're hopefully between 50 and 75% better, almost returning to near normal, feeling pretty good about our ability to perform the exercises in previous videos, particularly the draw in and core stabilization. So whenever I say center your core or stay centered in your pelvis, that's what we're talking about, is you're going to engage that core stability so that we can then continue to move and work our distal mobility. And that's the purpose of today's video. The only bits of equipment that you're going to need is a water jug. Fill it up as far as you can. Take some liberties in being aware of what's right for you. If you feel like just a half jug is going to be good, we will do some things with it so as to limit the amount of load on your back, but just be careful with how much load that you put in there. But a water jug is what you're going to need, about 8 pounds. A dumbbell will work just fine, or a kettlebell, but a water jug is usually common around the household. So we're going to begin with a quick warm-up. As you've already previously done in videos in the past, I like easy trunk rotations. We're going to work a couple different warm-up because today's exercises will have more in a prone or face-down position. 5 to 10 times each way. Bring these knees up. If you want to do a few hamstring or sciatic nerve glides, you're going to want these loosened as well today. We're going to do some yoga poses that will incorporate some nerve glide, and it will be helpful to have these mobile. Like 3 to 5 seconds each side. Pretty quick. Just move. Get these things limber. Again, if you're noticing one side is still worse than the other, or a little bit more tender than the other, spend some time on the other side. Spend a little more time on the side that's not painful. I know it sounds counterintuitive, but it's actually very helpful to even out or draw that pressure or tension away from the other side. It's like I'm pulling the string across the other side. So spend more time on the uninjured or not painful side. Good. Once you've done that, let's center our core. I almost forgot. We're going to do draw-ins, pelvic tilts, and a bridge. Do these a few times. Hopefully these now happening much more rapidly for you. You're not having to be as diligent about making sure every position is attended to, but still make sure we're drawing in, we're staying flat through our pelvis and our core, and as we bridge, we're getting those glutes and hamstrings involved. You're going to want these later on in our last exercise of today's video. Hamstrings and glutes are going to be what it's all about. Good. And then we're going to roll over. Let's get into a quadruped position, hands and knees. A couple of cat-cow here, always with our breath looking up. Exhale down. Big inhale, work extension. You notice how we did some gradual progressions of our head, neck, and shoulders. Sit back into a child's pose position. Smooth and steady, come back up into child's pose again. From here, give yourself some space. Typically, I like to do this on the ground. So from quadruped, for the first exercise, we're going to go into a downward dog, keeping your wrists and fingers right underneath your shoulders, your head and chin high. Straighten the knees. You're going to come right up, pushing your hips and buttocks towards the ceiling. Doing so gets a lot of the sciatic nerve glide on both sides equally. You notice you're going to try and keep it so your heels are able to relax and loosen and come back down to the floor. But you're also going to try and make sure that your back and arms are in a similar angle as your hips and knees are to your ankles. And from here, you should be able to breathe smooth and steady. About 5 breath cycles or 10 seconds is plenty. And then you can come down into a plank. Just 2 easy breath cycles here, keeping those knees straight. Head is up. Don't let the head sag down. Keep the head up, chin is back, and then push back up into downward dog. Relax those heels. Let those ankles relax so those heels can fall down to the ground. Relax your head and neck. What you also want to avoid doing is if you can push away, push your hands into the floor, push your head away from the floor, and then come back down. Again, about 5 breath cycles. And repeat that 10 times. So back and forth 10 times. About a 2-second plank hold is all that you need. And then you go back up into a downward dog position, about 5 breath cycles or 10 seconds. Repeat that 10 times. Take as many breaks as you need. It is a little bit challenging through the core, but we're working some mobility across the sciatic nerve and down to the hamstrings as we need to so that we can bend forward much easier. We're going to be back onto our back, and we're going back to dead bugs, but now we're going to add in our lower legs as well. So to start with dead bugs, we center our core. So posterior pelvic tilt, push your back flat into the table, draw in, pull the belly button down, bring your knees up. So we're in chair pose here while maintaining our back being flat into the table. Push your hands up to the ceiling. And like before, we would let one arm fall. We're now going to let one arm fall as we straighten the opposite leg. We're going to hold here 5 seconds and then come back up together. And we're going to repeat the other side. We're going to go back and forth. This arm can stay up, it can come down. It's not as important, but keep it in one position, 5 seconds. Back and forth. We're going to do this 10 times. If at any point we feel like we're losing this moment here. So watch, if you'll notice I'm getting lazy. See how I lower? That's just letting my core go. If I lose that center of my core, we have to take a break. Just go slow with it, okay? So recenter, regather, arms are back up, and then we're going this way. 10 seconds, 10 times. And repeat 7 more times and come back. This next exercise is hugely important because we're going to work some spinal stability in rotation. As we notice, we bend, lift, and twist. And so if we're going to bend and lift and twist to pick things up off the ground or grab something out of a drawer or filing cabinet, we have to be stable and be able to retain as much of that spinal stability in all those planes of movements. So in order to begin, we're going to get on the floor, table, bed, wherever you're at is fine. But these are called bird dogs. We're just going to work the upper extremity first before we incorporate lower extremity. There's a few key features I want you to pay special attention to. Okay, so we start out in quadruped. Again, our shoulders are stacked on our hands, hips are stacked on our knees. Head, chin, and chest is upright and stable. We don't sag through our shoulders and let our head droop. We stay active through all these positions. What we're going to do then is we draw in. So think of it as if we're gathering or sucking our belly and guts up towards our spine. Once we do that, we're going to reach out in front. Now you notice what this is going to do is we're going to want to fall or twist this way because now the stability is gone. The whole purpose of this exercise is to maintain stability and position as we reach out in front. Now you notice I'm not letting this drop down. I'm also not getting a lot of extension to try and get more. Okay, we're just going to reach out as far and as high as we can while we keep that center, this core centered. Count 5 seconds. 1, 2, 3, 4, 5. Come back down. You can take a break a second here and then regather, recenter. So pull the belly up, pull the guts in, hold, reach the other hand. 1, 2, 3, 4, 5, and relax down. You notice we're not losing any activity here. We're not letting our head drop and get lazy there. We're staying active. We're going to alternate the whole time through here. 2, 3, 4, 5. And we're going to repeat that 10 times total. So it's 20 total movements, but 10 per arm. So just count the 20. It's just easier to do. Every rep is a count. So go ahead and do this 16 more times and come back to us. Again, the biggest key features, remembering take breaks when you need to, making sure this back and pelvis is stable or centered. What tends to happen is we get archy through here or we'll start to twist and lose stability through one side as we raise an arm up. Very important to remember not to lose that position. So once we do upper extremity bird dogs only, we're going to then incorporate lower extremities as well. And the progression is we keep our hands down and we just do the leg. Now you notice I'm not rotating out. I'm also not getting saggy or droopy through the midsection. We're keeping everything drawn in tight, and we're kicking our heel to the window. So pull those toes to the shin. And of course what's happening is the spine, I'm tipping this way. So my spine is then working to orient myself into this stable or more upright position as we hold 3 to 5 seconds alternating legs. So we first work the upper extremities only, then we work the lower extremities only, back and forth. Now you notice as we're doing this, we're also level and flat through this back. It's going to get very apparent. We're going to do this 10 to 15 times, 5 seconds each side, pulling the toes to the shin, heel to the wall, to then go into a combo where we go legs and arms. Everything stays active and engaged. We're not arching or extending through the back. And we're staying stable. We're going to do this same kind of thing, 3 to 5 seconds, alternating 10 to 15 times. Okay, this next one, you can be on the ground or on the bed is fine. If you're going to be on a bed, put a pillow underneath your hips because we're going to work some extension. And we want to be able to do so in as level a plane as possible. And we typically will sink into a soft bed. So if you need to get a pillow, that's totally fine. These are called Supermans because we're going to work some extension, but we're going to do so without getting a whole lot of arch through our back muscles. And we're doing so to get as much through our glutes and hamstrings as well. So start on your stomach, hands down here at your side. Your first movement is we're going to almost try and push our fingertips down to our ankles. And we're going to bring our shoulder blades down and back. You notice my head and chin is tucked and upright. It's not extended or looking up, but we're still looking down into this extended position. As my shoulder blades are down and tucked, my fingertips are reaching towards the ankles. I'm going to squeeze the glutes to come up off the table. Now it's okay if your ankles come up, that's fine too. It's all about the glute squeeze and getting as much lat and shoulder blade retraction as possible versus getting this lazy and trying to extend through here. I'm going to get a lot more muscles across my spine. We want to avoid that by pulling those shoulder blades down and back. Reach down towards the ankles, head, chin, and chest is high, and then squeeze the glutes to come off the table. We're going to hold 5 seconds and repeat this 10 to 20 times. Good. Repeat that and come back to us when you finish. The last exercise of this video, get your water jug out, you're going to need this. And in standing, we're now going to incorporate a lot of the movements we've been working on in previous videos, especially as we work to bend forward. So now instead of the dowel rod or broomstick behind our back, we're going to take the water jug, put it behind your back, and this is going to help act as a counterweight or a counter boom to help you really recognize how much help our glutes and hamstrings are in getting us from a bent position to an upright position. So much like we did with that broomstick or dowel rod behind our back, this is going to incorporate our lats. So we squeeze our shoulder blades down and back, do the scapular retractions exercise that we've done in previous videos. And as we hold that tight, we draw in. Our core is nice and level, and our transverse abdominis is drawn in. And as we hold that water bottle, we then bend forward, shoulder blades are engaged, head, chin, and chest are all in alignment, and we work this forward bend this way. We have to be able to bend forward throughout life, and doing so safely is imperative. One of the common injuries you hear a lot of people is a bending forward and lift, and then they get injured in the back. What we're working to improve is to mitigate that risk by strengthening this posterior chain, these backside muscles that need to be extremely effective to stabilize that core. So using this water jug as a way to help counteract the amount of load that we place through the spine as we go down and bend. Shoulder blade squeeze down and back and forward. We're going to do this 20 times, just like this, firm and steady. Now you notice, by engaging my shoulder blades, it's really hard for me to flex or roll. So you'll know, if you're not, you're going to fall and let these shoulder blades fall forward. You have to really stay diligent to pull these shoulder blades down and back. Head, chin, and chest is all in alignment. As we then draw in and bend so we can hinge all from the hips. This hip hinge is the exercise. Repeat that 20 times total and then come back to us.